Good evening, everyone. Thanks for joining us. Again, for those of you joining us on Facebook, we are also calling some, 100,000 of your neighbors across Dutchess County. So those phone calls are underway as we speak. For those of you on the line, this is County Executive Mark Molinaro. For those of you who can see me, I'm sorry. But nevertheless, here we are again, March 24th with another town hall, both on Facebook and telephone. If you're on the phone with us this evening, you'll hear my voice, and of course also with us is Dr. Anil Waithian. Dr. Waithian is the Commissioner of Health here in Dutchess County and an infectious disease doctor. If you have a question and you're on the phone, please dial 0. When you dial 0, you'll be asked to record your question. If we can get to you, and we generally have about 100 questions and not that many minutes to answer them in, we'll bring you live to actually ask your question. Just give a second or two for us to flip you from the waiting room into the live telephone town hall. But again, this is County Executive Mark Molinaro. If you're following us on Facebook, please simply write your question in the comment section below the live feed. Now, just as a reminder, because I know people will start yelling at each other, and then me, we try to get to as many of the questions as we can on the comment section. What the folks here do is try to distill sort of the sense of multiple questions. So if many of you have similar questions, they're going to not say, Rita, this is Rita's question. They might say, here's a series of questions that you want to answer. So just be aware of that, and we'll try to get to as many as we can. We do have a lot of information to cover tonight, and why don't we jump immediately to our dashboard and talk a little bit about the data points. So far, we have conducted over the course of these last now nearly 13 months, almost 600,000 COVID-19 related tests. That has provided us 24,744 confirmed cases. Now, I only tell you that because we're 12 months through this pandemic, and it's just a reference point. But what is important to note is we are now at 1,331 active cases, 1,331 active cases. Now, Dr. Waithian and I will talk a little bit tonight about why the cases are on the incline, but they are on the incline. It's not unique to Dutchess County, but we are seeing an increased number of cases, and there are a few reasons for that. Probably among them, our own lack of sort of adherence to those basic mitigation steps. But we'll talk about that in a moment. We're monitoring 57 hospitalizations. 57 individuals are hospitalized today. We have been hovering in this number. I mean, frankly, we've been under 100 for quite some time. We've been between just about 40 and 60 to 70 cases or individuals hospitalized, and we're now at 57 hospitalizations. Sadly, 421 individuals who have succumbed to the virus. Let's talk a little bit about positivity rate. Currently, we're at 5.23%. 5.23%. That's as of March the 22nd. Reminding you, you're on the phone now with County Executive Mark Molinaro and Commissioner of Health Anil Waithian. We're on Facebook Live and telephone, a live telephone call. We're calling thousands of your neighbors across Dutchess County. And as we do, if you're on the phone and have a question, please dial 0. You'll be asked to record your question, and then when we can get you live, we'll bring you on to ask your questions. Following our vaccination information as well, added 2 new points to the county's dashboard. We have nearly 80,000 individuals. That's 80,000 Dutchess County residents. 78,365 Dutchess County residents have received at least their first dose of a COVID-19 vaccine. Excuse me, that represents 26.68%. We're going to get very close to 30% by the end of this week. We expect to exceed 30% next week, and you will start to see a rapid incline of those numbers, and I'll explain why in a moment. Nearly 34,600 individuals have been fully vaccinated. That's about 12% of the county's entire population having both doses, and I think it's important to know the progress that's been made in vaccines. We also have the positivity rate in the region. Let's look a little bit at that as well. Important to note, so these are the numbers as of yesterday, correct? So Dutchess County as of yesterday, our positivity rate is 4.7% yesterday. Orange County is at 8%, Putnam County at 5.1%, Rockland County at 6.0%, Sullivan at 8.6%, Ulster at 6.3%, and Westchester at 4.4% positivity yesterday. You can see the 7-day rolling average for each of these Dutchess, again, 4.8%, Orange 7.3%, Putnam 5.2%, Rockland 5.3%, Sullivan 6.1%, and Ulster 4.0%, with Westchester at 3.8% positivity. And so that has a lot to do with, again, number of positives versus the total number tested in any one community. But we have been hovering at this 5% for a little bit too long. And I will say out loud, we ought to obviously be aware of the increase in cases. That is something we want to be concerned about, and we'll talk a little bit about that tonight. So if you have you can't do that. Yeah, sorry, they were muting me, which maybe you want to. Thank you, though. If you have a question and you're on Facebook, please just write it in the comments section below the live stream. If you're on the phone, you're on with County Executive Mark Molinaro and Dr. Anil Wythian, the Commissioner of Health. Dial 0 if you'd like to ask a question. Let's jump to vaccine information so we have it. As I said, vaccine distribution is increasing. We are this week, doses received from New York State throughout Dutchess County, where it's about 5,500 vaccine doses allotted to the county for distribution this week. This is a very large number for county distribution. That's the facilities within county. The county health department will be administering some 3,300 total vaccines. That's 2,300 Moderna shots. That's up from last week, and 1,000 Johnson & Johnson doses that are going to be issued throughout a number of locations, pop-ups and partnership. You'll also see pharmacies with allotments this week. Benzer Pharmacy in Amenia, 100 doses. Pine Plains Pharmacy, great partner. Very happy to partner with all of these, but Pine Plains Pharmacy has been a great partner these last few years. 100 doses out of that location. Price Chopper Pharmacy in Poughkeepsie, 100 doses. And Tops Pharmacy in Rhinebeck. Now, these are not the only pharmacies that have doses. These are the pharmacies that received specific allotments this week. Rite Aid, Walgreens, and CVS all have access to doses and are scheduling throughout the county. I want to remind you, if you want to be considered, let's do this. We'll go right to this. Sorry. So also, hospitals and doctors' offices. Big expansion this week. Very happy about this. 1,200 doses to be administered by Mid-Hudson Regional Hospital here in Poughkeepsie. The Caramount Medical Group is administering 200 doses at their Oakwood campus, their Merritt campus in Fishkill, 200 doses, and Poughkeepsie Medical Group. Administering 200 doses this week. Now, these are not the only doctors' offices that have access. They're also not the only one. These are not the only doses that these particular groups have. We continue to partner. The county does continue to partner with several of our healthcare providers to conduct homebound vaccines and vaccinations for those who are medically frail. Dr. Wythian, we're already getting questions on the topic I knew we'd be getting questions on, so we're going to jump right to it. Why are cases on the incline? And I guess to add to that, I'm going to offer, what should we know about that, be concerned about that? And I'll also preface that by saying, 12 months later, our sense of, concern for risk has also changed a little bit, and that also plays into decision-making that individuals make, and the concept that there are options now, right? Businesses, schools, others have created alternatives to appearing in those locations, so many people are left now with choices to make, right? So the level of risk and the ability to choose how much risk you want to assume is somewhat greater today than it was 12 months ago, when we really just said everybody's got to stay home and everything is shut down. But Dr. Wythian, let's talk a little bit about why are we seeing cases on the incline, and what should we be concerned about?
Sure, Mark. You touched on some very important aspects of how people's thinking have evolved during this pandemic. So, when you compare last week with the several weeks before, we saw a 20% increase in terms of new cases. Interestingly, when you look at the case origins, we're seeing that there's a greater representation of cases arising from social gatherings and events that bring people together. And so that's one explanation. But again, some of the other things that we could attribute this increase to is the fact that I think people have some sense of optimism as they're seeing more, people vaccinated. There may be some degree of fatigue and just being tired of the restrictive measures that are in place. And I think this is contributing to changes in behavior that has sort of sustained us and kept rates low. Obviously, the other things that I am personally concerned about is how much of circulating variants play a part in bump in cases and in some of the clusters that we're seeing, especially in places, say, such as Maris that people may have been reading about in the paper. All these things probably play a part, but again, as you touched on, people's assessment of their individual and personal risks are changing as vaccination and the overall attitude towards the pandemic is sort of changing.
I'm glad you mentioned the variants. We do have a couple questions that I know online and have come in over the phone. We're going to go to Betty. Betty called in on the phone line. Betty, give us 1 second so we can go live and let you ask your question. I know you had one, Betty, regarding the variants. Go ahead, or the mutations. Go ahead.
Yes, I'm very concerned about the mutations because even though I'm all vaccinated, I'm still considering myself in phase 1 because of them. And my question, I read a lot about it in general, but I was wondering what percentage of, if you know, what percentage of the tests done in Dutchess County have been tested for the mutations? And if you know that, how is that coming out and what we have here in Dutchess County?
That's a good question. You kind of touched on two topics, Dr. Wythian. Talk a little bit about what concerns we might have regarding the variants and their prevalence, but also, if you don't mind, talk about how the state and the labs end up identifying those, because it isn't as thorough as a standard COVID-19 test. But go ahead, Anil.
Sure. The variants have always been a concern because, again, with so much community spread and transmission, and given that this is a virus, there is so much opportunity for mutations. I will tell you there have been multiple variants that have been identified. In fact, new ones are popping up, probably weekly. But there are some variants, because of innate ability to be transmitted quicker or be more pathogenic or have some ability to cause more clinical symptoms, may dominate the conversation. So you may have heard about the UK variant, which tends to be a lot more easily transmitted, meaning the wild type strain, while very infectious, may be a little bit more forgiving if we're not strictly adherent. But whereas the UK variant can be transmitted if there's any breaches in how well we adhere to the mitigation steps. The other variants of concern include the Brazilian as well as the South African, but they currently do not represent a large proportion of the cases that are being identified. I will tell you that because of the nature of the UK variant, it's probably going to be the dominant strain circulating in the U.S. in the next several weeks. In New York, in terms of surveillance testing, I cannot tell you the percentage of tests that are tested for the variant, but reference labs like Wadsworth periodically take tests and they do full sequencing on these tests that come into their lab. It takes about 2 weeks. We have known for quite some time that there have been cases identified of the UK strain in our neighboring counties. We also know that in the past that one of our residents was identified with a UK strain, and it would not surprise me in the least to find that as we have requested more sequencing of some of the clusters, we've identified that the UK variant will be more and more of a prominent cause of transmission.
And you had told me, and maybe I missed you saying this, but you had updated me. The concern is that maybe the UK variant is a little bit more severe in nature. Did I understand that correctly, or did I misquote you?
That is correct. So in the past, the UK strain was known and was reported out as being more infectious, but still not causing more morbidity and mortality. Now there's studies and observational data to point to the fact that that in terms of morbidity, hospitalizations, and death is probably 60% more serious with regard to these outcomes than the wild-type strain.
Thank you, Neil. So, Betty, the truth of the matter is those variants are likely in our community. The labs don't test every case. It's very random. And therefore, identifying that with an accurate picture is just not possible at the moment. But we assume that they're here, and we function and make decisions based on the fact that they are. We only have one identified UK variant case in the county as of today. Correct, Anil?
Yeah, one case that was identified today. We're still waiting on several of the requests that we made for full sequencing. So hopefully in the next week or two, we'll get results.
Great. We have a number of questions online regarding vaccination sites and some information. We also have a question from Stacy, I think in the town of Poughkeepsie. Stacy in the town of Poughkeepsie, give us one moment. We'll get you live as soon as I get the thumbs up. Stacy, go right ahead.
Hello?
Hello, Stacy. How are you?
Oh, yes. I'd like to know, how do we go about, does JCPenney have any of these sites? And you saying Mid-Hudson Regional. How do you register for Mid-Hudson Regional to get a vaccine if you haven't had any?
That's a great.
And you're above 50.
And you're above 50. You don't sound above 50.
Well, thank you.
Thank you, Stacy. That's a good question, and we had a number of questions regarding vaccine sites. Number one, understand that the entire distribution of vaccines is administered by the state of New York, and so the state identifies who is qualified and eligible to receive a vaccine and who is certified to administer the vaccine. In Dutchess County, if you'd like to find out about vaccine sites that are open and available, from pharmacies to the VA, from the JCPenney's location, which is a county health department site, to any other locations, you only need to visit, if you wish, dutchessny.gov. Just go to dutchessny.gov, the county website. You'll see one of the tabs at the bottom, the top right, is vaccine information. And if you scroll down that page, you're going to see all of the identified locations that the state has provided vaccines for with their online link. If you do not have access to the internet, and if you or don't necessarily want to navigate that process, you can call 845-486-3555, 845-486-3555. This is the Dutchess County COVID hotline. When you're on that call, you press 1. You'll hear the vaccine update. They'll tell you how many doses are available, where they are, and then if you press 2, an Office for the Aging volunteer or some staff member Office for the Aging staff member or volunteer will assist you in getting access to at least those links. So that's number one. You want to find out where vaccines are available anywhere in Dutchess, from Mid-Hudson Regional to the VA, go to dutchessny.gov, scroll down the vaccine information page. If you want to be considered for a Dutchess County Health Department location, so that those locations are as follows, and we had some questions regarding localized clinics, but understand we have 2 permanent clinics Dutchess County Health Department administers. One is at the former JCPenney's in Poughkeepsie. It's basically the Poughkeepsie Town of Wappinger line. We also have a location, the former CVS, on Route 22 in Dover. If you'd like to be considered for either of those 2 locations or one of the many pop-up clinics that we're hosting throughout the county, you need to sign up at dutchessny.gov/vaccine info form. That is online there as well. If you go to dutchessny.gov and then the vaccine update, there's a subscribe button, you'll see it. You're going to give us some information. Once you give us that information, 50 or older, essential worker, you can sign up now if you don't if you're not eligible. We will inform you of both availability when there's sort of an open call, meaning there's new appointments someplace here, you might want to consider that, or we'll email you to tell you or call you to tell you that your appointment is up. We're going to schedule your appointment, and we are doing thousands of those a week. So those are the places to go for that information. Now, when you go to our website, you're also going to see a link to the New York State regional vaccine sites. Every one of those is open to any resident in New York State. However, the state of New York does not allow the county to schedule, nor do they consolidate scheduling. So you've got to go to their page. When you go to our website, you'll see a link to their page. Go to their page, and they'll tell you what appointments are available at their locations. A lot of calls last week, and a lot of people who have commented, and I read a lot of them. You know, they had to go to Ulster, they had to go to Orange, and it's so much easier there. Those locations are our locations. The state, several weeks ago, only had one Mid-Hudson regional site. That was at the county center in Westchester. Last week, the state opened 2 more Mid-Hudson regional sites, one in Orange County, one in Ulster County. Those are in pretty close to where we live. There are 7 counties in this particular region. Dutchess County has ease of access to Orange and Ulster. Those are currently the state's vaccine sites. So those are all available to everyone. And when you look at our vaccine data on the dashboard, you will see those numbers, and those numbers do include any Dutchess County resident who has received a vaccine anywhere in the state of New York. So they are inclusive. Now, we are getting some questions regarding localized vaccine sites. So let's talk a little bit about what we've been doing. Not only do we have those fixed locations, as I said, one at the former JCPenney's in Poughkeepsie, one at the CVS, former CVS in Dover. Every week, we are also hosting, the Behavioral and Community Health Department is also hosting pop-up clinics. Last Wednesday, we were at 2 Wednesdays ago, we were at John Jay High School in the town of East Fishkill. Last Tuesday, we were at Brookmead and Rhinebeck. Today, Wednesday, we were at and administered at the Beacon Middle School in the city of Beacon. Next week, we expect to be at Pine Plains, the Stissing Mountain School. And then subsequent to that, you're going to see us in Poughkeepsie, city of Poughkeepsie. You're going to see us in Millerton. And then we expect to come back around throughout the county. So you're going to continue to see them. At the same time, again, once you're on our list, if you're a homebound senior, if you're 80 years old, you need some help, we're going to identify you and reach out to you if we have availability for appointments. We are also partnering with healthcare providers. We're partnering with a number of healthcare providers to do homebound vaccinations. So for those seniors or individuals who are homebound, we have Office for the Aging staff, and we have partners with some of our healthcare providers that are vaccinating individuals who are homebound. We're also, with those healthcare providers, vaccinating individuals who have frailty or severe medical concerns. So that, we think, is the best approach. I know some people just, why aren't there more at a single location? Why can't I drive to this one place? We're actually doing a huge amount of vaccination throughout the county. In some cases, we're coming directly to the residents. In fact, what you're going to start to see over the next couple of weeks, and we've been working toward this, is also smaller clinics where we might go to a senior housing. In fact, next week I think we're going to begin that process. We may go to an assisted living or an independent living senior complex and provide 50 to 100 doses and then move on to the next one. So we're using all of these tools to ensure a broad outreach, and that is within the context of the state giving us what vaccines they have. And the state provides it. I will tell you, the last couple of weeks, we've had an increase in vaccines allotted to the county. We weekly receive updates from the state providing us additional vaccines. In fact, we asked to double our Johnson & Johnson doses. We were able to get that so we could do more of these homebound and localized clinics. We have some individual organizations around the region that couldn't administer their own vaccines, so they were rerouted to us. So at the same, we're making decent enough progress. I know it's frustrating, but I will tell you, every week we are getting more and more vaccines. But please do sign up. You have to be signed up at DutchessNY.gov if you wish to receive an appointment at one of the Dutchess County locations or one of our pop-up clinics, or you wish to be considered as a homebound individual. But if you go to that website, you'll see those other locations, including links to Mid-Hudson Regional physicians' practices and otherwise. So we have on the line Bob. We're going to go to Bob in a minute. I'm told that Bob is 80 years old. I don't know if Bob wants the world to know that, but he wrote it down. So, Bob, if you have a question, go right ahead.
Yeah. My daughter doesn't let me drive anymore.
Oh.
She doesn't let me go any place. How do I get to a place to get one of these shots?
Well, why can't your daughter drive you?
She works at 2 jobs.
Okay, well, that's understandable. I know that feeling. My dad worked 2 jobs for, I think we saw him about for an hour before he went to bed. Bob, here's the deal. So a couple things. If you are homebound, please, so in that case you would be. If you're not signed up on the county's site, we need you to either go online to do that or call this phone number. So Bob, if you're sitting next to the phone and you have a pen, take this phone number down. You're not live anymore, so you're just listening, but that phone number is 486-3555, 486-3555, and you just dial 2. You dial 2, you're going to go to an office, right? Correct? You're going to office, it's 1 then 2. Go to 1 then 2. Sorry, Bob. 486-3555, dial 1, then dial 2, and you'll get to an Office for the Aging volunteer staff member, and he or she will put in the system that you can't travel. And if you can't travel, Office for the Aging home nurses or one of our healthcare partners will come to you and vaccinate you. If there's some other need, if you don't want to be done at the house, there is transportation. There are transportation options through public transit and what have you. But that's the safest way to do it. We'll come to you and get you scheduled. So please take advantage of that, and we'd be glad to give you a hand. And I hope your daughter gets a break and doesn't have to work so much. But we're happy to help you. Dr. V, we had a question on Facebook, a couple actually regarding blood type, regarding the vaccine. So let's do these in rapid order. First, one question, Dr. V, what are the worst side effects of the vaccine? And I think that's good, right? So what are the reactions that many people have seen? Would you say the reactions to these vaccines are more or less what we see in all vaccines, regardless of what the vaccine is for, and how severe are they? Although I hate to frighten people, but to go through that if you don't mind.
Sure. I'll address the mRNA vaccine first. So as most of you know, the mRNA vaccine is a new platform, highly efficacious, but they require 2 doses. So in the early clinical trials, they did note several instances of something called anaphylaxis, which is a severe allergic reaction. That was found during the clinical trials. What we've noted since then, with more than 70 million Americans being vaccinated, is that the rate of anaphylaxis is overblown. So we are finding that the mRNA, which is the Pfizer as well as the Moderna, is very safe vaccine. But that does not mean that people will not experience symptoms. And the symptoms are consistent with the how brisk or robust of an immune reaction a person experiences. And so if you have a very brisk immune reaction, you may have symptoms of malaise, body aches, joint pains, sometimes mild fever, headaches.
That's how I feel after these town hall meetings.
Well, this is...
Go ahead. I love them, though. I keep coming back. Go ahead.
But these symptoms do not last long and usually abates within 2 or 3 days. And that's the mRNA vaccine. The other vaccine, the Janssen, the typical side effects is typically local, meaning swelling or pain at the site. People may have some body aches, some malaise, but the rate of severe side effects is extremely low in the Janssen product. And we just don't have as much experience in terms of sheer number of doses of the Janssen vaccine given. But what we've experienced and what I'm in my review of the literature is that the side effects are minimal and are consistent with other vaccines.
Thank you, Anil. Second question. At this point, do we expect that folks will need an annual booster or annual vaccine for this particular virus?
That is an excellent question. I will only give you my suspicion and opinion. Because of the nature of the coronavirus and because of the nature of how it mutates and the fact that it's probably going to circulate in the human population for quite some time. So the short answer is yes, I believe that we probably will require boosters with adjustments to account for the variants.
Very, very good. And then lastly, there's a question regarding blood type. Does being O positive blood type prevent COVID?
I have heard that blood types confer either protection or slightly increased risk. I cannot at this time give great detail on how much or how pronounced or how valid that comment is.
Okay. So we have Joseph on the line. We're going to Joseph in a second. Joseph tested positive 3 weeks ago and wanted to talk a little bit about still getting the vaccine. Joseph, go ahead. Joseph, are you with us? If not, Joseph's question was, he tested positive 3 weeks ago. Is he still eligible for the vaccine? Anil, why don't you talk about that in general? If one tests positive, how long before they can be vaccinated? Why don't you do that?
Sure. So there is no contraindication of receiving any of the vaccine if you have tested previously. The only caveat is if you are actively isolating or in quarantine because of active disease or an exposure, we will not vaccinate you. You should not come to the pod or go to a medical office or any site for vaccination until the dates of confinement have passed. The other thing that I will say is depending on how symptomatic of a COVID illness you have, if someone is severely symptomatic with COVID, and this is my opinion because it's not something that's really codified in clinical guidance, I probably would only get a 1-dose vaccine series as opposed to the 2-dose. Because if you were symptomatic, you very likely, naturally, your natural immunity is mounting a very brisk immune reaction. You still should get vaccinated, but if it was me or my family, I would prefer that they only get one shot after a symptomatic case of COVID.
That's a good point, but I want to clarify. If you only get one of the Moderna or Pfizer shots, you're not technically considered vaccinated, are you?
Because of the way the trials were constructed, you are fully vaccinated if you receive 2 doses of those respective shots.
Right.
If you receive 1 dose of the Janssen, that is considered a complete series for Janssen.
Okay. So, question from online: if one is fully vaccinated, what are the protocols if they come into contact with somebody who tests positive? That's a good question. So, if I'm fully vaccinated, I'm a contact to somebody who's tested positive. Absent symptoms, there currently is not a quarantine or isolation requirement. I know.
That is correct, Mark.
So if you're asking that question, keep in mind if you're fully vaccinated, you come into contact with somebody who tests positive, we obviously would want you to monitor your health conditions, but there is no isolation or quarantine requirement. Only that if you start to become symptomatic, and it's possible, right? These vaccines are not 100% effective. They're 90, 80, 60, 70% effective, depending on which one you've gotten, or if you maybe have received one but not both of the Moderna and the Pfizer doses. But if you start to become symptomatic, then there would be the consideration for isolation, test, and potentially quarantine. That sound about right?
Absolutely.
Yeah, good.
Absolutely.
I've learned something in 12 months. Isn't that great? I think we had Olga from the town of Poughkeepsie. I don't know if Olga's on the line. We want to go to her. Olga, are you there?
Yes, I am.
Are you my friend, Olga?
No, I don't believe I am.
No, I'm kidding. I only know two Olgas.
I had to think about that for a second.
Do you want to be?
Yes, I do.
Okay, Olga, go ahead. What's your question?
Something very silly happened yesterday. I called the hotline, the COVID hotline for the state.
Oh, yeah.
Because I had a question about traveling during Easter holiday.
Yes.
And coming back into New York, I remember hearing on the news that Governor Cuomo had changed the mandate, I guess, for quarantining.
Correct, yeah.
As of April 1st. So I called just to confirm, and they told me they knew nothing about it. So I had them go to governor.ny.gov.
Yeah.
And then they were able to read it, but said they were never informed of the facts, so whatever information is being given out by the hotline is obviously incorrect. But they couldn't answer whether a COVID test was still required at the airport or in order to get on a plane back into New York.
Right.
So now I have part of the answer, but not the entire thing.
We're going to give you the whole answer tonight. I will say in their defense, although I'm being kind, sometimes the information that gets from the New York State Department of Health takes time to get to that COVID New York State hotline, although this is about a week ago, so I feel they've had enough time.
10 days.
but I give them that. There's always a lag. I know, there's always a lag.
Right.
So you are correct. What you found online, currently the state has waived the quarantine and the isolation requirement for domestic travel. You can travel as you wish. Anil, you can correct me if I'm wrong, but unless the airline itself requires some testing, which they don't seem to be, there is not a testing requirement to return into New York or to leave New York of any kind. Anil, do you know that to be? Am I wrong? But I believe that's the correct answer.
I think that is the current guidance.
Yeah.
Yes.
So Olga, wherever you're going, be safe. Wear a mask.
Okay.
Wear a mask. If you're celebrating Easter, happy Easter to you, but you can travel after April 1st. No isolation quarantine requirement, but please or anyone traveling, and we'd encourage anyone traveling, just monitor your own health conditions, and if you feel like you're worn down, you're not feeling too well, just stay in and let it pass and be sure that you're not COVID positive, but otherwise you're free to go.
Great. Thank you so much. And please run for governor again.
Oh, dear. Thank you very much.
We can use you.
That's very kind of you. Thanks very much. Thank you.
Thank you.
Yes. Yeah, well, apparently Olga is my friend. Olga, thank you very much. We want to go to Rita. Rita had a question. Is this my friend, Rita? Rita has a question regarding the online system. Rita, go right ahead.
Oh, yeah, hi. I am your friend.
I'm happy to have you on the line.
I wanted to know whether the opt-out form, if that has been corrected, because I had originally signed up for the vaccine online, and your form only became available to opt out on March 12th.
Yes, and you've already been vaccinated?
And I had my first dose in February.
Okay, fair enough.
And I couldn't know. There was no way to let anybody know. So when I saw that form, I opted out.
Yeah.
And on St. Patty's Day was my second dose.
Good for you.
And on the 18th, I received an email to tell me that if I wanted to go get a dose, I can click on the link, and I'd be able to get a dose at the Galleria between 2:30 and 5:15.
Yeah.
So evidently your form is not working.
No, it is. So let me explain that. So the opt-out form that we added does not stop those notifications coming to you. It takes you out of the list for the pre-scheduled appointments. That particular email, just so you know, we had the availability of some appointments, we had the availability of some appointments that that at the last minute became available. So instead of trying, because we only had 2 hours to get them scheduled, instead of trying to call 35 people, we just pushed it out and said anybody who's on the list can sign up. So when you opt out, you're not going to be included in the county's call list for a specific appointment, but you'll still get that vaccine update. And the reason that is because we have a lot of people who still want the information to share with loved ones, family members, or what have you. If you would like to opt out entirely, you never want to get an email from Dutchess County again, you can do that through the Dutchess Delivery subscription. You can pull out of the subscription. So rest assured, if you've opted out, you're not included in the appointment scheduling, but you're still getting those weekly updates, or if there's some last-minute availability, because you might have a loved one or a family member you want to share that information with, and we don't want to presume that you don't. And so that's why that forum was set up in that way. So we're calling your neighbors. This is County Executive Mark Molinaro. You're on the telephone town hall and Facebook Live town hall. If you have a question on the phone, dial 0. You'll be asked to record your question, and then we'll bring you live to ask that question. Excuse me. And so, sorry. So we're calling thousands of your neighbors across Dutchess County, and you're on the line with County Executive Mark Molinaro and the Commissioner of Health, Dr. Anil Wythian. If you're following us on Facebook and you'd like to ask a question, dial 0. No. If you're on Facebook and you'd like to ask a question, simply write it in the comments section below the live stream. I'll be happy to get to that. And as always, nice thank you to our American Sign Language interpreters who keep up with me because I speak fast and a lot. Did I get that right? That's what you say about me. Am I close? Or what did I just say? Oh, fine. We've been doing this for 13 months. We've covered it all. So, if you have any questions, please dial 0 on the phone, or simply write that question in the comment section below the live stream. Sean, let's talk a little bit about some other things going on in Dutchess County while we have folks SAP Happy Maple Weekend. We're going to get to John in a minute. Okay, so we'll get to John in just one moment. But I want to recognize our great park staff, Dutchess County Parks, hosting SAP Happy Maple Weekend. Anil, I know that you're thrilled. You're ready to go to SAP Happy Maple Syrup Weekend. That is this week, right? Visit dutchessny.gov/parks. Friday, pancakes in the park. If you're a senior citizen and you'd like free pancakes in the park with Dutchess County's Bowden Park award-winning maple syrup, you can do that. That's at Bowden Park on Friday. And that's for senior citizens. On Saturday and Sunday, we have a story walk. If you give a pig a pancake, did you find out? Is that if you give a mouse a cookie? No. Mm-hmm. It's the same series. So if you give a mouse a cookie, then what? If you give a pig a pancake, then he'll want syrup. If you give the pig syrup, then he'll want a fork, right? I have kids. That's the way it works. So this great story walk in the park. That's Saturday and Sunday if you give a pig a pancake. And Sunday and Monday, hands-on maple education classes at Bowden Park. And also if you get to Farmers and Chef's restaurant Friday through Sunday, you can take advantage of the Bowden Park maple syrup menu. SAP Happy Maple Syrup Weekend. I think I got it. John in Dover. John in Dover, go right ahead. You with us, John? John. John is 80 years old and wants to get vaccinated. Are you there? We lost John. John wants to get vaccinated. John, you have two options here with the county. If you'd like to visit dutchessny.gov, visit dutchessny.gov. You can sign up online at the vaccine information form. We'll call you, and I will tell you if you're 80 or headed near 80, we are making a real priority to get all of those senior citizens on our list scheduled for appointments. So if you're mobile and you can drive, or you have a vehicle, if somebody can drive you, we will get you scheduled. So please sign up at dutchessny.gov/vaccine info form. If you don't want to go online, or you can't go online, you can dial 486-3555, 845-486-3555, 845-486-3555. Dial 1, dial 2, and we will sign you up. How's that? You like that? Okay. Other questions, please? We've been doing this too long. Other questions? If you have a question, dial 0 on the phone. We'll get you live into the queue, and you can ask your question, or simply write it in the comment section below the live feed. Great question. We're going to go to Gene in Fishkill. Dr. Wythian, Gene in Fishkill has a question regarding the effectiveness of the vaccines. Go ahead, Gene.
Yes, hi. I'd like to know on the UK, if you have been vaccinated, which I have the 2 doses, what protection is that going to give you? Are we still going to be in trouble on that one? I know there's probably going to be a booster coming later there, too. Plus, by the way, if you have had the virus, from what I understand, my daughter got it down in Nashville. She's a nurse. And if you do get it, did their suggestion now all the results are saying you should wait at least 90 days, they told her, if not longer now, they're thinking, by the way, if you do have the virus before you get a vaccine. So,
fair enough. So let's do this. Number one, Anil, the effectiveness of the vaccine as it relates to the variants, in particular the UK variant. And then secondly, just reiterate what the official language is for if you've tested positive, you've had the virus, how long should you wait to get the vaccine?
Sure. So with regard to the variants, with the UK variant, the current vaccination effectiveness should be as posted by the clinical trials. The Brazilian strain as well as the South African strain, the effectiveness against those strains are less, but there is still protection, especially with regard to severe illness and in terms of hospitalizations and deaths. But with regard to the South African strain, if we're talking about a booster, they're probably going to adjust the code for the mRNA vaccine to address those type of variants that, that the current vaccine does not address well in terms of effectiveness. But coming back to the UK variant, the current vaccine platforms should address it fairly well. With regard to the question in terms of how long you should wait, as I mentioned before, there is no contraindication to getting the vaccine after you had COVID. With that being said, people who had symptomatic disease may choose to wait 90 days. That is an issue of choice. Some people are availing themselves of vaccine when they become available, but they could opt to wait for the 90 days.
Thank you for that. And we also get questions, Anil, if I've got the first dose and I'm scheduled for my second dose and I miss my second dose appointment. Now there's a process and it's very convoluted in the state. We're trying to make it, we're really pushing on the state to make it easier. But you've said before, get your second dose, right? There's not a problem necessarily if you've waited longer. Get that second dose, you get that second dose, you're considered vaccinated. Is that fair? Did I explain that correctly?
That is correct. So the guidance, that the last reading of the guidance that came out is that you have up to 42 days since the first dose was administered to get your second dose. But even if it goes past that, if you get the recommendation is to just get the second dose.
And so there's not an easy way in the state of New York, if you've missed your second dose, to simply schedule it someplace else. Right now, to be clear, if you've gotten your first dose at a location, now mind you, if it's one of the county health department sites, we schedule your second dose before you leave, and you will come back to the place we tell you. We're not moving. There have been scenarios, and we've seen it. There have been scenarios where an individual's gotten their first dose at a pharmacy, and then that pharmacy may not have that second dose, and so they're being moved to another location, or somehow there was a bit of a mix-up. There's not an easy way just to pick up and schedule your second dose. Additionally, the state doesn't necessarily allow you to go to somebody else and say, hey, I got my first dose there, can you give me my second dose? Technically, you're supposed to continue down that stream. But do be both patient and persistent. You should be clear with the pharmacy or whomever issued that first dose that they really are obligated to get you that second dose. And to the extent that we can assist in telling them that we can do it, we just don't get access to doses that we could just randomly use. Additionally, the pharmacies are doing a lot of the Pfizer doses. Some are doing a lot of the Pfizer doses, and county government here has not been provided Pfizer. We're doing the Moderna shots and the J&J, the Johnson & Johnson shot. So just be aware of that. It's not the easiest process. We apologize for that, but we do try to assist. Anil, online, if I had both doses of my vaccine and I didn't experience any symptoms, did it still work?
The answer is yes.
I think somebody wants side effects.
Yes, it's effective. There may be situations, for instance, if there are individuals who were on immune therapy, if they're on high-dose steroids, if they have any condition that interferes with the immune response, it may be blunted. But if those conditions do not exist and you did not have any symptoms and you received 2 doses, yes, you could be assured that, yes, it's effective.
And so why, I know there's some science to this. In general, we've seen on the second of the Pfizer and Moderna shots, you've seen sort of this extra kind of more people getting, chills, sort of minor flu, I'll say flu-like symptoms. You can correct me on that second dose. And we've kind of said, well, that's like your body really jumping into hyperspeed to kind of say you're good, you've been vaccinated. What's the explanation for that?
So I'll give an analogy. If your body's immune system meets an enemy for the first time, sometimes it doesn't know how to react. But nonetheless, a battle ensues and your body typically wins. The second time it meets that same enemy, the reaction may be much more robust and explosive, and usually the body, your immune system does not have as much of a hard work in terms of defeating that enemy. And so the second time you get your vaccine, your body's been primed, it's expecting, and the next time it sees it, it's just going to go nuts in terms of its battle, and that's what's going on. So if you develop symptoms after the second dose, it's typically because your body's mounting a very brisk antibody reaction.
That is a great analogy. The one I would use is if I came to your house the very first time, you might welcome me in, but when I come back the second time, you'll probably lock me out. You may not want to see me the second time. I think that's a good one.
Let's not test that.
Don't worry, I won't come back. We're going to jump to, in a moment, Chris, we're going to go to Kathy and then Christine. Let's go to Kathy first. Kathy had a question. She has some reaction to the flu shot. Go ahead, Kathy.
Hello?
Hello.
Can you hear me?
Yes, I can.
Hi. Hi, Mark. I won't make you cry this time.
Oh, you did? Oh, you were? Yeah, that's Kathy. That's right. I remember. Thank you. Go ahead.
Hi. I usually have a bad reaction when I get the flu shot. I usually end up with the flu and a real strong reaction to the flu. As far as, my age and having a weakened immune system, I usually get very sick from the flu these past few years. But I'm wondering if I get the COVID vaccine. I already had COVID last year. It's been almost a year. It's going on my 1-year anniversary. I just want a quick shout out to Vassar Hospital for helping me out. Dr. Pine and Dr. Pasha were wonderful.
Nice.
I'm worried about getting the vaccine. It's been a year, and I don't know if there's any correlation between getting the vaccine and getting sick.
So let's do that. Dr. Wythian, why don't I break this question down into actually 3 of them? So because I think we'll touch on a couple others. Number one, if you ordinarily have a reaction to the flu shot or some other vaccine, what's the likelihood you're going to have a reaction here? Number 2, if you've had COVID, and you take this particular vaccine, are you likely to have some sort of COVID-like reaction to it? And then thirdly, I'm sorry to do this to you. Thirdly, if you take the vaccine and you have the vaccine, again, why would I have a reaction of that nature? So why don't you answer those in that order, if you don't mind? Go ahead.
Sure. What I will tell you that again, everybody behaves differently. Their immune system, their bodies behave differently when challenged with, a vaccine or immunologic insult. And so people have come to our clinics with various numbers of reaction, whether it's to vaccines, to bee stings, to peanuts, with a long history of side effects and even anaphylaxis. And what we have seen overwhelmingly is that they tolerate the COVID vaccine. There's no cross-reactivity. The only two pieces that people should be concerned about is if you have a significant allergy to something called polysorbate or polyethylene glycol, we would suggest that you not get the mRNA vaccine. But we don't expect crossover from the flu shot to the COVID shot, and you should rest assured that you will probably take it without incident. The second one is in terms of having COVID and getting a COVID vaccine. Again, as a physician, I would recommend you getting the vaccine because even with symptomatic COVID, the strong suspicion among immunologists and physicians and public health officials is the fact that immunity wanes. You had mentioned that your episode of symptomatic COVID was about a year ago. And given what's going on now in terms of the circulating variants and so forth, getting the the COVID vaccine may be quite protective in terms of the situation for COVID. Could you?
I will. The third question for me was more. There are occasions where you might get the flu shot, and people feel as if they get the flu. The difference between, and we understand. I think we basically understand the mRNA concept. You're not getting COVID, right? We're not giving you a dead COVID and putting it in your body. The Johnson & Johnson shot is a little bit more like a flu shot, but that too is not. It's not. Well, you explain what it is. So if I get the shot, is it possible I could, get COVID?
There is absolutely a risk of getting COVID, but not from the shot.
Yeah.
What typically happens, we're vaccinated during a time when the pathogen that we're being vaccinated against is circulating in the community, and so I could get a flu shot or a COVID shot and walk out and be exposed and come down with either one. But I could tell you with absolute assurance, and the science will absolutely back my statement, is that whether it's the mRNA or the Janssen, which is the Johnson & Johnson vaccine, you cannot get COVID from either of those vaccine products.
Thank you. We're going to jump to Christine. Christine had a question regarding the length of effectiveness of the vaccine. Christine, go right ahead.
Hello?
Hello, Christine.
Hi, how are you?
Very good. How are you?
Yeah, good. I've been hearing that if you do get the vaccine, which I have not gotten yet, that it only lasts for 3 months anyway. Is that true or not true?
It's sort of not true. Anil, go right ahead. Why don't you explain the right? I mean, what they're saying is that initially, to be certain, they want to monitor after the 3 months. But go ahead, Anil. Why don't we talk a little bit about the length of effectiveness and what we seem to be learning about the vaccine and its prolonged effect?
So a lot of our information and data comes from observational studies with COVID itself. And we know that people who've had symptomatic COVID may come down positive for COVID 3 months or later. And so that is when the thought process or the idea came out that, again, antibodies last only 3 months. But there are other observational studies that support the fact that after vaccination, it could be much longer. The reason why we are not trumpeting this is because not enough time has lapsed and not enough data has been gathered to give you a definitive answer in terms of how long it lasts. We've been only vaccinating since late December, and it's only March. So beyond 3 months from the observational studies with symptomatic COVID, we just don't have enough time since vaccination started taking place.
And they basically establish a window that, frankly, we go through the 3 months, we're evaluating how much longer, and that might prove another 3 months or another 2 months. So, I mean, it's really to suggest that there's a window of time that they've got to be at least continue to study to determine long-term effectiveness. Yeah,
the clinical trials that were done on individuals, those individuals are still, blood work is being done to see how long the antibodies last for. And so, as data becomes available, it will be presented.
It's kind of like my father used to say when we traveled the long distance on vacation. Every time we say, "Are we there yet?" he'd say, "It's just around the corner." And then we'd round the corner and he'd say, "It's just around the corner." That's about what we're dealing with. 3 months is just around the corner, and then it's another corner, and then it's another corner. But obviously, as there's a body of evidence, right, they'll be able to determine long-term effectiveness. Is that about right, Anil?
Absolutely.
Okay. We're going to jump to Ann had a question. Anil, you said something that got her attention, and it got mine as well. Ann is going to ask you a little bit about your clarifying if you had COVID and getting the Johnson & Johnson shot. But I do want to say this out loud. This is your opinion to folks who can choose to do this. But go ahead, Ann. Go ahead and ask your question.
Yes, thank you. I have had both. I'm in my 70s. I've had both of mine. I've had Pfizer. That's all fine. My daughter is an essential worker. She's a teacher, and she's scheduled to get her vaccine at our medical providers tomorrow, and it's Moderna. Now, what caught my attention, and I'm not sure if I understood correctly, because in November she had COVID, she did have symptoms. Did I understand correctly that you suggested that someone that has had COVID and had symptoms would be better off getting Johnson & Johnson than the Moderna?
I knew when you said this out loud, Anil, that you'd set off a firestorm.
Okay, yeah.
So go ahead.
Yeah, let me start off by saying that this is only again, it's medical opinion from one doctor. Your daughter has an appointment to get a vaccine, and it happens to be Moderna. My recommendation is keep that appointment, get that vaccine. If we have the option, if somebody has had symptomatic COVID disease, and this is just my opinion, if it was me or one of my family members, symptomatic COVID brings about a significant antibody response. And I know that, again, if we boost it with another vaccine, their antibody response, especially from, studies that have come out of Europe, is significant and probably sufficient and protective. And so that is why, this is my opinion, that if it was me or one of my family members, I would say if you've already had COVID and if it was symptomatic COVID, it may make sense to just get the Janssen vaccine. With that being said, because your daughter is already scheduled to get the Moderna, I would not change that appointment.
So the advice remains: get the vaccine, take the vaccine that you have option to. But you're suggesting that again, having had symptomatic COVID, your body has built up a bit of a reaction to it, a response to it, immunity to it, and therefore a single dose of something may ultimately be sufficient. But again, that's not a body of evidence that we have. That's an opinion, an educated opinion, but there's not a body of evidence to kind of point to that suggests that's the only thing we should be concerned with. Is that about right?
That is correct, that is correct, and I doubt that any of the public health bodies will come out and say, in that scenario, only take the Janssen vaccine. Right. I don't think that's going to happen.
But there is some study, right, that that perhaps had you been symptomatic, COVID positive symptomatic, that a single dose of any of these might be sufficient to provide adequate protection. There's study on that now. It's not conclusive, and no one's making a decision, but that's an ongoing dialogue. Is that correct?
I believe that I believe that the data that's out there is supportive of that. The question really is whether the CDC or the public body will come out and say this out as a guidance or a recommendation.
Okay, fair enough. I think it is, I know, a little bit confusing for folks, but the basic protocol, and this is not, it is certainly you're telling us it's safe. The basic protocol is take the vaccine you're offered, regardless of whether or not you've tested positive or had symptomatic or asymptomatic COVID. But again, if you're given that choice and you've been symptomatic, you may consider the J&J option as reasonable. And by the way, could I say this, Anil? You tell me. If I've been asymptomatic positive and I take the J&J dose, is it more effective than the average 60 to 70% effective that they've claimed?
I do not believe you can make that
Okay,
statement.
good. I always like when you correct me. So fair enough. So I hope that was somewhat clarifying. Take the dose they're willing to give you. And the good news is it sounded like her daughter may have been getting it at a physician or some medical provider. He or she should be the person you speak to about your own medical condition. And then so with that, I think we're going to go to a couple more phone questions, Chris, if you don't mind. We're going to let's go to Kathy. Kathy asked a question regarding antibiotics. I think Chris will go to Kathy and then to Eleanor. So Kathy, go right ahead. Are you with us, Kathy?
Oh, yes. Sorry. Yeah, my question is, if you're on an antibiotic, can you get the vaccine?
Okay, great question. Anil, if you're on antibiotics, can you get the vaccine?
Yes, you can. The antibiotics will not blunt your immune response.
Okay.
If you're on other drugs, such monoclonals, high-dose steroids and all that, they may interfere, but antibiotics should not. Antibiotics is geared towards addressing an active infection.
Okay. Are there known prescriptions or medications that they're suggesting don't get the vaccine at this point? And I apologize. I'm doing two things at once and I shouldn't. Go ahead, Anil.
The only thing is if you received antibody treatment or a monoclonal treatment for COVID, you may want to delay your vaccination for 3 months or more. Okay. But other than that, the medications that, like for instance, as I mentioned, steroids, high-dose chemotherapy, all those things modify our immune systems and may affect its effectiveness in mounting an immune response, but that should not prevent people who require the COVID vaccine because they have an underlying condition from getting that vaccine.
Okay. Thank you for that, Anil. I think we're going to jump to Eleanor. Eleanor wants to know about getting the vaccine at her doctor's office. Eleanor, go right ahead. Are you with us, Eleanor?
My question was the same.
Okay, well, we'll take your question. You don't sound like Eleanor. What's that? Are you Eleanor's husband? What?
No, my name is Mario, and I had the same question.
Okay, well, we'll take you. Your question is, why can't you get the vaccine at your doctor's office? The short answer is because the state of New York has not given your doctor the vaccine at the moment. So the state of New York gets these vaccines distributed from the federal government to the state. The state then selects who gets access. Now, early on, the goal was, and understandably, was to get it to individuals like health departments and others who have broad distribution ability. And they have, over the course of the last 3 weeks, started to increase the number of doses they're getting to individual doctors. If your doctor isn't getting one, he or she is supposed to file for the ability to do that with the state of New York. But they, because of limited supply, haven't yet expanded that to all physicians. Now, there are physician practices and individual groups throughout the county that do have access, but that's the determination of the state. As to what doctor's offices have access. And if you need to find out about it, 2 places to go. You can visit dutchessny.gov. You want to check to see who has availability. That's dutchessny.gov. Go to the vaccine information tab. Or if you don't want to have to go online, you can call 845-486-3555, 486-3555, and an Office for the Aging staff or volunteer will assist you. We're going to go to Lori, I think. Lori had a question regarding nursing homes and visiting their loved ones. Lori, go right ahead.
Thank you, Mark. So grateful that you took my call.
Oh, you're welcome.
I have not been able to hug my dad in over a year now, and I'm just curious that if he's fully vaccinated, and I will be fully vaccinated as of tomorrow, I'm getting my second dose, why can't I take him out, one, without him quarantining when he gets back, and two, when are we able to go inside and visit other than the, social distance visit for a half an hour once a week?
Yeah. So, the short answer is because the state regulates them, and the state has said not that you can't do that yet. The longer answer and the right one is we at this point need to find ways to make those visitations happen. And so the state has not yet permitted that. And I'm really, it's heart-wrenching. And believe me, we hear it quite often. We know this is real. The state did relax some of the visitation restrictions, but those visitation restrictions that you just described basically remain. But Anil, from a medicine and a vaccine perspective, if my loved one, my mom or dad, is vaccinated and I'm vaccinated, what's the risk of having that kind of interaction? Wouldn't we say that is, that's appropriate? Perhaps you remain masked to some degree, just to be sure you're not carrying it around the nursing home, but the direct interaction with a loved one would seem to be the benefit of vaccination.
So that is a great question. I will tell you that, again, there is some degree of complexity to that. When two people who are vaccinated interact, obviously they're both protected. The only caveat is if one is a carrier or colonized with COVID, and the second individual becomes colonized because of that interaction and go back into a congregate setting, the potential for spreading to people who are not vaccinated within that facility is significant. And so that's one of the scenarios that are coming into play in terms of these facilities developing their policies. And so your first question in terms of if it's just the two individuals and their interaction and you could isolate that, there is nothing medically that should prevent that.
Yeah.
But again, as I mentioned, it's a little bit more complex than just those two individuals.
If you're going into a congregate care setting, but
Correct.
I will offer that we agree. The counties across the state have said, listen, you've got to create the mechanism to allow these kinds of visitations, and frankly, the isolation is so detrimental. Knowing the risk, right? We have to be sensitive to the risk of transmitting the virus in a congregate care setting. But especially as we now have sort of breached this vaccination effort, meaning more and more are becoming vaccinated, those things should come into play when it comes to making that kind of visitation happen. Take your loved one out, or perhaps some other means of having the direct interaction in a way that isn't socially distant. And I feel for you, and we all do, and we are advocating, but the state is very, as you can understand, sensitive to this population and sensitive to bad policy that it established about a year ago, and that I'm sure is affecting their judgment. And so we'll continue to advocate. Yeah.
And Mark, I would add that again, we've been monitoring facilities and their coverage rates, and so again, these types of interactions will be more common as the coverage rates of both residents as well as employees of vaccine coverage go up.
Great, and I appreciate that, Anil. And we have a great team at the Behavioral Department of Behavioral and Community Health who have been working with these facilities every week for 13 months now, trying to assist and monitor. But believe me, we're very sensitive to it. We obviously know there are so many families that remain not able to have that connection. I think we're going to try to get to a couple more phone questions. Why don't we go to Corazon? Corazon? Like my heart? Mi corazon? Okay. Corazon, are you with us?
Hello?
Mi Corazon, ¿cómo está?
Hello.
Hello.
Hi, this is Corazon. Yes, my question is, I signed up for the Dutchess.gov for my vaccine, and it's almost a month, and I am a cancer survivor, and I just want to know when I'll be called to have an appointment.
When you signed up, did you click that you had a comorbidity or an underlying illness?
Yes.
You did? Okay.
Yes.
So I'm going to find out for you. I would think that you should be very soon because we are getting through that list pretty quickly. So be a little bit patient, but I will find out, and someone from the Office for the Aging will likely be back in touch with you. Can I ask you, you don't have to do this now, but you've signed up with your name is on that list. If I look up Corazon, I'll find you?
Yes.
Okay.
Yes.
I can't imagine there's too many of you.
I'm also with my son, but my son is getting it from his workplace.
Yes, yeah. There's a lot of options for folks who have that if they're employed in a job that's already eligible. Corazon, we're going to look it up for you and find out where you are on the list. And if you're close to where one of these locations we're having a pop-up clinic, you're more likely to get a phone call. But we'll look into it for you. Okay.
Thank you so much.
You're very welcome. Thanks for calling in. We're going to jump to Ann. Ann had a question regarding her Pfizer shot, her own vaccine. Ann, go right ahead, Ann. Ann, are you with us?
Hello?
Yes. Hi, Ann. How are you?
Oh, hi. I'm supposed to get my second shot tomorrow.
Go for it.
And I'm going to get a cortisone injection in my back April 25th. Is that all right, or should I wait it out?
Dr. Anil Wythan, she's getting a cortisone shot later in the month of April. Should she get her vaccine tomorrow?
Absolutely. There is nothing that should prevent her from getting the vaccine.
Okay, go for it. Take that shot, and we hope that you are not in a lot of in pain and can make it through to your next shot, and you're doing well.
Oh, I was supposed to get it this month, but I got my first shot on the 4th, so I canceled. I just pushed it out a little bit. So I'm glad I called. I feel much better. Thank you.
You're very welcome. So be safe, be well, and we hope you're doing okay. So thank you for that question. I think we're going to go to James. James had a question on the phone. I apologize. I think James was earlier, and if he's still there, had a question regarding the changing eligibility. James, go right ahead.
Oh, Mark?
Yes, sir.
I'm in Millerton. I'm 73 years old. I applied for a vaccine back in January, and in the 1A group, and I'm wondering why they have changed the age requirement from 65 and dropped it down to 60 before finishing up all the applicants in this age group 65 and older.
Yeah, it's a good question. So now actually it's been dropped to 50, just so you know. The state this week started at 50. They just keep moving the goalposts. I will tell you, if we had access to more vaccines, we'd probably get through the list a lot quicker. But they keep changing the eligibility, and the vaccine allotment doesn't increase as much. James, when you signed up in January, that was likely in the early stages of the can I ask you a question? What I'd like you okay, so James, what I'd like you to do is reach back to us. I want to be sure, because we did transition from one sign up, and we asked people to please update your information after January. And if you didn't do that, it's not your fault if you didn't, but if you didn't update your information on our list, you might not be getting all of the outreach that you deserve. So would you mind please calling us at 486-3555. Call us at 845-486-3555. Push 1, push 2. And when you get a human being, say Mark Molinaro told you to call, and you wanted to be sure your information was updated in our call list, and we'll take care of that for you. We are going to have a clinic in Millerton in about 2 weeks, so if we're in your neighborhood, and certainly if you're a senior citizen, we may be able to get you into that clinic. So what I'd ask you to do again, James, is call 845-486-3555. Dial 1, you'll hear a recording. When you get that recording, dial 2. When you hit 2, make sure that you get to a human being, and there's likely to be one. Tell them that I told you to call and that you needed to make sure your information was up to date in our list. And if it isn't, they'll get you updated. And if it is, we'll try to make sure that we get you into one of the localized senior clinics as soon as possible. We are trying to effectively get through 80 and then 70 and so on. The other is, I'll be candid, right, there are a number of people who only, not you, James, but there are a number of people who, only recently decided they wanted to be vaccinated. So now we have individuals who are in those age groups that made the choice, or their child told them to do it, or what have you, and they're doing it. So we are getting more individuals who previously were not interested in the vaccine. It is almost the end of our call. This is County Executive Mark Molinaro. You've been on our Facebook Live and telephone town hall. I want to remind you that we'll be back again. We're not going to stop yet, but we're back again next week. Facebook Town Hall is March the 31st, 3 p.m. on March the 31st. And then we will be live again on both Facebook and telephone on Wednesday, April the 28th at 5:30 p.m. Do we have any more questions, Chris, that you're going to send my way? Because if we do, we'll take one. But nevertheless, I appreciate you being on the call. We're going to be again live next Wednesday, the 31st at 3 p.m. and then telephone town hall on April 28th. Anil Wythian, thank you for joining us this evening. I do want to note that my cousin Dana Sullivan has been watching, and she says that none of my jokes are funny, and that is true. No, I don't know. Maybe she said that. But we appreciate you watching this evening. I do want to thank you for a number of questions. It's a good question. We have a number of questions about why they can't choose which vaccine they're going to get, and that's because there's more demand than supply. I mean, at the end of the day, it is that there are 100,000 people who want a vaccine, and in the state of New York, there is only a fraction of that distributed in any one location. So we can't have you pick between them. You can decline a Dutchess County appointment until you get the one you want. You can talk to your physician until he or she has access to the one that you want. Or you can choose to take the one that you're offered, and that currently is the only option. And it's mostly because there is just much greater demand than there is supply of any one of these vaccines. Now, we do expect over the next couple of weeks a significant increase in the availability of the Johnson & Johnson doses. The federal government has made a significant purchase. The president announced that the goal is to get every American eligible by May 1st, and they feel that the Johnson & Johnson dose will have greater availability as we get closer to May, and therefore that particular vaccine will be more available to more people. So hopefully that answers a little bit of the question. I mean, there's no easy answer. It's that there's just not enough, and there's not enough flexibility available to the provider or flexibility in the supply. And so really, we've got to offer you what we have. And if you don't want it, you can wait till the next call. But again, that's sadly where we are. But we're making good progress. And Neil, when we started this, we talked a little bit about, we might not see, broad access to the vaccine until the fall of this year. We now seem to believe that we might have broad access in early summer, and so much faster distribution than I think was initially expected. Anil.
Absolutely, and this is wonderful for a community and a nation who wants to get back to doing the things that it was used to doing before the pandemic.
Absolutely, and with that, a number of guidances and restrictions have been lifted to some degree. We're still working on certain issues. I do want to mention that we expect to start baseball on May the 11th. Hudson Valley Renegades kicking off their season as a New York Yankees affiliate at Dutchess Stadium. We'll have some capacity to have fans in the stands. So be patient with them as we try to organize that. So we're grateful for that. Do we want to go to Douglas? This is our last question. I hope Jeff doesn't get upset. Last question of the night. Douglas, we're going to you. You have a question regarding your son in the hospital. Douglas, go right ahead. Doug? No, Doug. Doug's son's in the hospital, can't visit him. Is that basically the message? And so each of the hospital facilities do have, under the state guidance, have the ability to establish their own visitation. However, the hospitals in Dutchess County are accommodating individual visitation, if that was the question, but you have to work through your particular hospital, and they are regulated by the state of New York, which is establishing those guidances. So, ladies and gentlemen, this is County Executive Mark Molinaro. Thank you for joining us on Facebook Live and our telephone town hall. It's been a great evening. Thank you to our American Sign Language interpreters. They like to keep up with me. No, they don't, but they do. And all those who helped to organize tonight. And in the meantime, be safe, stay strong, and be kind to each other.